In Nigeria, at least an estimated 150,000 children are born with the sickle cell disease every year, and a significant portion of the nation's population have the sickle cell trait. This genetic blood disorder, which affects millions worldwide, is more common among Black people. Cases of the disease are prevalent in sub-Saharan Africa, with Nigeria having the highest number of cases in the world.
So it's not something that you can just get, out of the blue. You have to inherit it from your parents. So if your mother is AS and your father is AS, there's a chance that the babies they give birth to might be a sickler. So the father and the mother need to have the S trait, that's the S trait, to be able to give birth to a sickler.
In Western nations like the United States, the month of September is recognized as Sickle Cell Awareness Month, aimed at enlightening the public about the disease. But the alarming rate of ignorance about one's genotype and the disease in Nigeria may be a cause for concern.
I don't know my genotype. I have a little idea about sickle cells. A sickle cell person is one whose cells are unable to function very well.
Yes, I do know my genotype. I'm an AA. I have seen the horrific impact and the way it cuts short the life expectancy.
Despite the discovery of the disease over a century ago, there has been inadequate research and few systems put in place to help those suffering from sickle cell crisis in Nigeria.
And I imagine this pain being a consistent one on your lifestyle on a daily basis, every day, lucky, if you're lucky, maybe 2 days, to 2 days. So like, let's say 4 times or 5 times in a week, you're down with the pain, or you're in the hospital. So because of this, it gets to affect our society, the warrior society. It gets to affect our society in terms of education, in terms of study, in terms of working, in terms of relationship.
Before they get into preschool, nursery, primary, secondary, tertiary institution, they should request for all these investigations to be done, and sensitization programs should be done to these individuals before they enter into these institutions. I believe this will kind of like create a better awareness for people to know their genotype, and also request to know the genotype of their partners, and that would reduce the level of sickle cell within the country.
While doctors and patients anticipate more treatment options for managing the sickle cell disease, the focus should be on providing support and education for patients, families, and communities, amongst others. Gabriel Egu, reporting for News Central.